Hi everyone. So I'm going to be sharing my story of basically my thyroid cancer journey plus COVID vaccine injury journey. It kind of goes together. So here it goes. So my story begins, I should say, I think like in 2021, before I got the vaccine. I was having these just random symptoms that my doctors were not able to put together, kind of were also dismissing at the same time, not knowing what to do, just managing symptoms. And so there was this like one night in March, I remember, because you don't forget this is something you can't forget. I woke up in the middle of the night with one eye, not being able to see out of one eye. And I was just like, what's going on? Like, did I sleep on my eye? What happened to me? And it lasted for about 20 minutes where I couldn't see out of one of my eyes. And then I just ignored it. I was like, it's probably nothing. Then a week later, it happened again. And this time I was having numbness on the opposite side of my body. I think it was my right eye and my left arm my right eye I couldn't see out of, and my left arm was feeling numb. So I told my PCP at that time, and he referred me to a cardiologist. He told me to go to the emergency room, and we did the whole outpatient workup thing. And so we did like the 3-day EKG where like you go home with it, the monitor, and it just monitors your heart. So at that time they thought I was having a stroke, some form of like a transient ischemic attack, and they were just trying to rule that out. And when the CT scans and MRIs came back negative, they didn't know what was wrong, and they just said, it's nothing, just go back home. And so when I did the 3-day EKG monitor thing, I went home with it and I gave it back to the doctor, to the cardiologist 3 days later, and he saw that I had a resting heart rate of 167 to 180. And we made the plan to implant a loop recorder to see if I had some sort of arrhythmia that I was born with, what was going on. Because my blood work was coming back normal, I was not having any hormonal issues, and the type of cancer I had was thyroid cancer. I had papillary thyroid carcinoma. So when my hormone levels were normal, they just didn't know what was wrong with me. And so it was a really hard decision to do the loop recorder thing. For those of you who don't know what that is, it's like this little device that they implant under the skin, close to your chest, like to your heart, in your chest cavity, and basically it continuously monitors your heart rate and basically like an EKG, and just keeps going like on a loop. For this thing can last 3 years. The battery life is 3 years. And so that's what we did, and I didn't want to do it because I was afraid. I was like, I'm 27 now, and this was 2021, so I was like, I think about 24, and for a 24-year-old to have this problem, it's like, it's pretty scary. Like, you don't know what's happening. And so I made a decision to do that, and we implanted the loop recorder, and it really didn't change anything. It was just constantly like, I'm not doing anything, and my heart rate's like 160, 170. At that time, my cardiologist was saying that, I should be on a blood thinner, and just to make sure I'm not gonna have a stroke because of the numbness I was having. And it was really just in my left arm. And then, so I didn't really have any other symptoms besides like brain fog and not being able to concentrate, but that wasn't really, what was bothering me. The heart rate was the bigger issue, because I couldn't walk 1 block without being short of breath and not doing anything. And so this was like, I think between March and April of 2021. And in May of 2021, I got the most amazing news of my life. At that time, I got into the graduate program of my dreams in New York, and it was mandatory to get the COVID vaccine to be in the program. Like, they would not allow you on campus, and there was no online option, so they would not allow you on campus. So you either would get the vaccine or not accept your admission to the program. So I was thinking what to do. You know, I really wanted to go to the school, and I worked so hard to get in. I didn't want to give it up. And eventually I was like, I'm probably gonna get the vaccine eventually. Like, what's the difference if I do it now or later? So yeah, I would have waited had I not been mandated. I probably would have continued to wait, just because my mother died from COVID during COVID. She was in a nursing home, and their nursing home got hit pretty hard. So a lot of the residents died there. And so I would have waited. I wouldn't have gotten the vaccine. But my graduate program made it mandatory, so I went ahead, I ignored all my symptoms, and I was like, let me go get the vaccine, because I really wanted to go to school. And my graduate program made it a requirement. They were not accepting the Janssen vaccine at that time, Johnson or Janssen, whichever one it was. They were only accepting Moderna and Pfizer. And when I was hearing in the news that people with Moderna were getting blood clots, I was like, I'm already at risk, so I'm just gonna go with Pfizer, because I didn't hear anything about Pfizer, or maybe it wasn't being reported, but I didn't hear anything about that. So I scheduled to get my first vaccine in June so that I could go to my program in September. And they required two vaccines. So the reason they weren't taking Johnson was because it was a one shot, and they wanted you to have 2 shots. So if I would have gotten Johnson, they would have made me get another 2. So it was a good thing I didn't get anything yet. But unfortunately, it wasn't good if I got anything at all. So yeah, I got my first vaccine. I got it in the left arm because I knew that I'm a righty, so I didn't want anything to happen with my right arm. And ironically, it still did. So I went to a pharmacy for my first shot. I got my first shot in my left arm, and within like 15 minutes, I got really dizzy. Everything was spinning, and I felt like I couldn't see. I was getting itchy and swollen. So the pharmacist gave me water, and then he said, go home. And so I went home. I went to my aunt's house, actually, because I was afraid to go home. And she thought I had lice because I was so itchy. So I went to the emergency room that night. I went to the emergency room, and I told them I got the vaccine. I'm having an allergic reaction. So the doctor came over. He gave me like the allergy cocktail, which is Benadryl, dexamethasone, and at that time they gave me famotidine IV. They said that was like the FDA protocol for COVID vaccine allergy or something, which worked. Like, it helped. Like, I stopped itching and I was able to breathe. They gave me a steroid taper for 3 days, and then of course I told my PCP what happened. And I also asked the emergency room doctor for a letter because I said my graduate program was requiring 2 shots. So he gave me a letter, but he wrote on the letter, she can't get Pfizer, she can get Moderna. But Moderna is an mRNA vaccine, and they're both mRNA vaccines. So it made no sense what he wrote, and they didn't allow my exemption request, so they denied it. And 3 weeks later, I had to get the second shot. So I told my PCP, like, I don't have a choice, they're making me do it, and he said that he doesn't want to get involved, to call back the emergency room doctor and tell him to give me the steroids to pre-medicate me. So that's what I did. I called the ER doctor. I was like, you wrote the letter, you didn't write it correctly, and now they're making me get the second shot. So I need you to refill steroids for me because, you know, I'm gonna have an allergic reaction. I already know that. And the school nurse told me that because it was in a pharmacy, that I should get it in a hospital setting, which is what I did. So I scheduled my second vaccine in a hospital setting, pre-medicated with Benadryl and steroids. They gave me my shot. I had another reaction, and I went to the emergency room after, even though I was in the hospital. They didn't want to do anything, but when I left, I was like already feeling like I'm gonna pass out, like I couldn't breathe. I went to the emergency room, a different emergency room, and they told me I'm already pre-medicated, there's nothing they could do, they could just monitor me, which is what they did. And then a few days later, like I was having headaches already, but a few days later my other symptoms started, which I didn't know was from the vaccine. I thought it was just my other heart rate symptoms just going out of whack. And at this point, if you're wondering, I'm the stupid one, I'm the crazy one for getting the second shot, even though I had an allergic reaction. I don't know how life was for all of you guys back then, but for me, my mom just died in 2020. I didn't have a dad, and I was on the verge of being homeless, not having anywhere to go, and everyone was getting the shot. Nothing was happening to them, so why would I think something should happen to me? And my school was requiring it, like I needed it to be in the school, to be in the dorm, or else I'd be on the street without a job, without a career, without anything. So when I weighed out the risks, it was just an allergic reaction. It wasn't supposed to be like paralysis and cancer. It wasn't supposed to be all of that. Like, had I known I had cancer, I probably wouldn't have gotten the vaccine. So, but even so, like at that point, I think everyone was saying those who are immune compromised should get the vaccine because they have a higher risk of getting COVID. But yeah, had I been diagnosed with cancer, I wouldn't have gotten the vaccine, I know for sure, because I already would have known that my body's been through a lot and not to do that to my body. But yeah, so a few days after my second shot, I was having all this kind of weird sensation problems, like numbness, kind of below the waist. I got like incontinent and I couldn't feel anything. My legs were numb, everything was numb. Like I could stand and walk, but I'd be stumbling and feeling all numb. So I'd go to the emergency room and they would do MRI scans because they thought I had like spinal compression or something. I think it's like, totally saying this wrong, cauda equina syndrome. That's what they were trying to rule out. And when the MRI was coming back normal, they said that I should see outpatient neurology because they thought I was having MS. And my labs again were all normal. So I was already like in my graduate program, I got in, I was doing good. And then I started to have this pain everywhere, and pins and needles, pain everywhere, not being able to function or concentrate or do anything, not even able to complete my assignments. And by the end of the semester, I was getting kicked out. The director of the program contacted me and said that I would need to withdraw from the program because I'm too sick to be in the program and I don't have a diagnosis, so they couldn't allow me to have medical leave. And people requesting medical exemption should do it before the semester starts, not during the semester. So I had to withdraw from the program, which was very devastating to me because I worked so hard, and I didn't lose hope. I thought eventually, like, I'd figure this out, I'd go back. Boy, wait till the end of the story. Not what happened at all. So I was in the emergency room so many times during that fall semester because of the pain, because of everything that was happening. And I also had a part-time job at a physical therapy clinic, part of a major healthcare organization in New York, which is where I'm from. And so there was an emergency room around the corner from my job, and after every shift I would be in so much debilitating pain I wouldn't even be able to make it home. And I would go to the emergency room. They would treat my pain and they would tell me go home. They got so used to me already that they didn't even question anything because everything was always normal. They would just do their protocol CTs and protocol labs and treat my pain and say follow up outpatient. And so already I was having more episodes where I was passing out I don't know if it was from the pain or if it was from the numbness or losing my vision, transient vision loss. I don't know from what it was, but I was trying to get a car at that time, and the doctor in the emergency room diagnosed me with a seizure. And I've never had a seizure, thank God. And you know, I had to get that cleared up because then I can't drive if I'm having seizures, and I wouldn't want to put myself or anyone else at risk, obviously, on the road. So I had to follow up with neurology, and the neurologist wanted to do an EEG. So those are the electrodes that go on the head, and they monitor the brain waves and see what's going on. So we did that inpatient in a hospital over the weekend for 3 days, and they had to do an emergency endoscopy because they, for some reason, like, they tested me for everything, because they were trying to find out what my brain waves were slow in sleep stages, awake stages, and just anything that I was doing, the waves were just sluggishly slow, which I laughed when I heard that because it was kind of funny to me. And they were trying to figure it out. I don't remember exactly how the conversation happened, but they suspected that I had celiac disease, and that's what was causing my brainwaves to be slow. Like some sort of neuroceliac thing. So they did an emergency endoscopy, and it came out normal, but I told the doctor that I was already gluten-free for 2 years. I ended up going gluten-free because during COVID I was having a lot of abdominal pain. I didn't know what it was, and my PCP was telling me to change my diet, and so that's what I did. I didn't really know I had celiac at that time. I just kind of did it, and it worked for me. Like, I started feeling better. So he never really tested me for it. He just said that people have non-celiac gluten sensitivity, and so that's probably what I had, and we went with that. My mother had celiac, which is why I didn't sound like, you know, if she had it, I could have it, but like, it wasn't for sure, so yeah. But anywho, so we did the endoscopy, and the treatment plan was to continue to be gluten-free, and so they ruled out seizures for sure. Like, it was the EEG, the 3-day EEG showed no seizures, which is great. So this was already January of 2022. It's now 5 months since my second shot, and I'm still having the same symptoms, and nothing's getting better. The heart rate's getting worse. I'm not even doing anything. I still have the loop recorder, and so less than 6 months later, my job required the booster, and I told my job, I'm like, it's not even 6 months. The FDA said you have, like, it should be 6 months. A CDC or whoever, someone said it was 6 months. And so they're like, fine, at exactly 6 months, you need to show proof of your booster or you're going to be terminated. So 6 months was approaching, and I was shown my termination letter. I was told, this is ours, and tomorrow it's yours, unless you bring your proof of your shot. So February 9th, I tried to get exempt, actually. I didn't actually just go straight for my booster. I did see an allergist. I tried to get exempt. I was seeing an allergist before all of this happened, before the booster thing happened, because once I was told that I had celiac, I had to follow up outpatient with a gastro doctor. And so he was trying to do his due diligence by saying that I should start eating gluten and then see how I feel. And I told him every time I eat bread, I can't breathe. And he didn't believe me. And so he sent me to an allergist. So he sent me to an allergist, and I didn't want to see the allergist because I was like, you know, I'm not allergic. I have other symptoms. I've had so many symptoms. Everyone's telling me I have so many things. I just turned 25 and I didn't want to deal with anything. So I wanted my life back. And at that point I was also like, the numbness I was having was also in my chest. I was also having numbness in my chest. And I was really upset about the loop recorder because I thought that's what was causing it. So I told my cardiologist I wanted it out, and he didn't want to take it out. So I changed cardiologists, and at my first visit with my new cardiologist, he had told me that my blood pressure is very low and my heart rate is sky high. And in his book, that's anaphylaxis. And I'm like, but I'm still standing. And he's like, so it doesn't mean that you're not going through anaphylaxis. Your body could be going through delayed anaphylaxis. And I'm like, what does that mean? And he said that basically it might not be visible on the outside of like the swelling, but it could be happening internally in the cells, and you can't really see it, you can only feel it. And so that's why it's coming out into my elevated heart rate and low blood pressure. So I kind of went with it. I saw the allergist, and he told me to start keeping a diary of what I'm eating and everything I put into my mouth. He blood tested me for whether I'm allergic to it or not. And so, like, it was kind of an interesting thing. Like if I had celery, I had to write down 8 celery at 2 p.m. or whatever. And yeah, everything I ate. So I couldn't eat in restaurants. I couldn't eat out at all, which was really sad because I love eating out. And so, yeah, I had to keep a food diary. He tested me for everything. I eventually got annoying, so I was just like, let me just focus on the foods that I do like, because if I like it, I'm gonna eat it often. And if I don't like it, there's no need to test it because I'm not gonna eat it anyways. So that's what we did. It turned out that I was really going into delayed anaphylaxis, and I have allergies to all these kinds of foods that I've been eating my entire life, like tomatoes, bananas, peanuts, yeast, which is why when I was eating bread, I couldn't breathe because bread has yeast in it. And a whole bunch of other things like grapes and different cheeses and stuff like that. And so obviously I had to take that out of my diet, which is really difficult. At first I was like, this is like not even real. I can't even believe this is happening. Like, I love tomatoes. I can't not eat tomatoes. Like, I could live without bread, but tomatoes, I don't know. Which was very hard. And then I noticed that I could breathe better. My heart rate was going down. And that cardiologist, the second one, he removed the loop recorder, which I really wanted the numbness in my chest to go away, but it wasn't going away. I was really upset about that. It really made me depressed. And this was already March, but I did not talk about my booster dose, what happened after that. So, yeah, so I got my booster, my third shot, February 9th, 22, because my job was saying they would terminate me, and they had my letter. And so, again, I was pre-medicated with 80 milligrams of steroids and Benadryl. I got it in the pharmacy, and then I walked over to the ER because I already knew what was going to happen based on experience. And the emergency room didn't do a thing. They were like, well, you're already pre-medicated, we can't give you any more medication. So I went home, and initially I felt fine. So actually, I don't know if these allergies happened after the second shot or the third shot, but at some point they happened, and this was like in between. So I ended up going to work. That was a Wednesday. I ended up going to work on Thursday and then Friday, and on Thursday again I went to the emergency room because my coworker noticed that my arms were swollen and that I was very puffy. And that doesn't really happen overnight from steroids. You have to be on long-term steroids in order to be puffy, kind of like I look right now. So yeah, and then basically what happened was I went to the emergency room. They discharged me again, told me there's nothing they can do. And then already on, I think it was the following week, I think it was like a Saturday or Sunday, I ended up back in the emergency room. This time I went to a different one because the other one just kept sending me home, and I already felt like I couldn't breathe. So they admitted me for allergic angioedema for 3 days. I was in the hospital. This was my third shot, so my booster, but my third shot, because I think they were saying that the first 2 shots were really considered one round of vaccine. So the booster was my 3rd shot. 6 months later. So yeah, so I was in the I was admitted for 3 days for allergic angioedema, and they pumped me with steroids, Benadryl, and morphine for pain, and then discharged me once the swelling went down. And this whole time I had thyroid cancer and no one knew, which drives me crazy till now, because I was having symptoms and I just can't believe no one figured it out and kept dismissing me. So that was in February, and then I already said between like March and April we were going through removing the loop recorder and the food diary thing. And then somewhere in between there was this one night where I was eating dinner and I couldn't pick up my arm. I was just leaning over the table and I'm like, my arm just went totally numb, totally unable to move it, couldn't bring the fork up to my mouth, and I was freaking out. My aunt was there and I'm like, I can't move my arm, like my shoulder is not moving, like I can't feed myself. And I noticed this droop. I had this scapular dyskinesis droop, and my scapula was winged and was on the side, and it was so ugly, but it was mostly painful than ugly. And I kind of at first freaked out. I didn't know what was happening, but I also ignored it a little bit because I had work and that was all I had left now, because I didn't have a home, I didn't have my school. So I was living with my aunt at that time, and basically I was like, let me go to the doctor, let me see what's happening, because if I can't move my arm, how am I gonna work? I worked at a PT clinic and I was rehabilitation support staff, so part of my job description is assisting patients with their exercise routine and making sure they don't fall. So, you know, usually patients don't fall, but if they would, I'd be the one to catch them. But it doesn't really happen. It's just part of the job description. Also putting away equipment, cleaning it because it was COVID time, stuff like that. And so you really need both hands and legs for that. And I went to the emergency room after my shift one night, and I told the doctor that, you know, I'm having pain and I can't feel my arm. It's like I'm barely lifting it. And she did a shoulder x-ray, gave me a sling, and said I'm fine. And I ignored it, but I worked at a PT clinic, so I had one of the therapists evaluate me, and thankfully he said, you're not crazy, you do have scapular ringing, but you know, you can barely tell. Only a professional would know that. Like a doctor would barely realize that, like not being able to see that. You can't see it on a scan. So I didn't really know what to do with that, like, you know. So all I knew was that I was in pain, I was numb, and it was getting worse. And the numbness in my leg was not getting any better either. Neither was the incontinence at that point, which was super devastating and humiliating, but no one needed to know until now. I'm sharing it with everyone. So yeah. And it came to a point where I wasn't able to do my job, which was really, really devastating for me because it was literally all I had left. I wasn't really making much money. It was more like to keep me sane. And there was this one shift, I went to the emergency room and I was screaming from pain. Like, I didn't know where it was coming from. I had no idea. Like, my whole body was on fire. I had no idea where it was coming from. And so I went to the emergency room, and it was a weekend. I got this resident physician, and he's like, I looked at your chart. You're always here for pain medication. You're not getting any more. Get out. And I was like, I'm not going anywhere. I'm in pain. Do your scans, do what you need to do, and I want to see your attending because I can't go anywhere in this pain. And the attending came over, they did CAT scans, they didn't find anything, but I was obviously screaming from pain, like, you can't fake that. And so the attendant came over and he said that he would give me pain medication and then I should see an oncologist. One out of all the doctors I saw, and this one was in the emergency room, had told me that I should be checked for cancer because I was in so much pain. And he had said to me, like, I'll never forget these words. He said, I've only seen two kinds of patients scream like you, patients in labor and patients with cancer. And he's like, you're obviously not in labor, so you probably have cancer because you're in pain. So I was like, I'm 25, I don't have cancer. And I just was like in denial. And then when I couldn't move my arm and I lost my job, like I had to resign. I couldn't put patients at risk. If I would drop like a dumbbell or something on them, I couldn't do that. So I had to resign. And I was really upset about that. And so if I was like, if I lost my job, I got nothing else to lose in this life, I might as well go see an oncologist. And so I saw an oncologist. He looked at my history. He told me I'm fine. And he said that because I'm on prednisone, I'm on the steroids. After my booster, I couldn't get off the steroids. I was so swollen, I couldn't breathe. I couldn't get off steroids. I was on 80 milligrams of prednisone. And he said the scans wouldn't show anything because the steroids are reducing the inflammation. So it defeats the purpose of the scans. But he said he would order it, and whenever I'm tapering, I can go get them. And I was like, I'm just gonna do it. If it shows, it shows. If it doesn't, it doesn't. So this was already in May, and I was still having the elevated heart rate, even though I had tapered. Well, not tapered. I had went off the foods that I'm allergic to. For some reason, my heart rate was still elevated. My hormone levels were still normal. And my cardiologist, I was kind of getting annoyed with him because he didn't want to like do anything, and there was nothing he could do. He didn't know what to do. He already diagnosed me with delayed anaphylaxis. I was now the allergist's problem. And so yeah, basically he prescribed me Xanax, and when it worked, he said I have anxiety and I should see a psychiatrist. He didn't taper me off, which I had terrible withdrawal. And I did what he said because I just wanted my life back. So I saw a psychiatrist, and the psychiatrist said to me, with an elevated heart rate of 167, it's not anxiety, and he would not treat me. No psychiatrist would treat me because that's clearly a physical symptom, and that needs to be dealt with before I can be treated for anxiety or anything else. So we did that. That didn't work. And so I went in for the scans. I'm like, I'm already, I've lost everything. I've got nothing more to lose. Let me just do the scans. So this was already in May of 2022. I did the scans on my neck, and that day I got a call that I potentially have thyroid cancer and it needs to be dealt with now, like yesterday. And I was so in shock. I didn't want to believe it. I didn't want to do anything with it. I was just 25 years old and I didn't want to deal with it. This was just too much for me. And so I found a new doctor, new PCP. I really find not such great doctors sometimes. And he suggested to do a biopsy of my thyroid to see if it's really cancer, because the oncologist referred me to an endocrine surgeon who was going to remove it immediately without even checking if it's cancer, because the scan was enough for him. He didn't really need to see a biopsy result. And I told him my symptoms. I was like, I'm having numbness and tingling in my chest and my arm and my neck. I can't feel anything on the right side of my body. I was already like walking as if I had a stroke. They already thought I had a stroke, but my brain scan was normal. And he assured me, he's like, if you remove the thyroid, all your problems will go away. And I was like, really? I was so happy. I just wanted the numbness to go away. I don't know, for whoever would be watching this, if you know what numbness feels like, it's very uncomfortable and it's very painful, especially in your chest, breast area. It's very painful. And it's not something you want to deal with. Like, if you put your hand here, you can feel, and if you put it here, you can't feel anything. It's like you can see your hand touching, but you can't feel it. So it's pretty scary and it's painful. And so he said he wouldn't do a biopsy because it could spread. He would just remove the whole thyroid, and then he informed me of the risks, and I was terrified. I'm like, this is normal for some people, because some people take thyroid replacement and they have a thyroid. And I've never even taken a thyroid replacement hormone. I don't know how my body will react to it, if we could just remove part of the thyroid, not all of it. And he said, unfortunately, no, we have to remove all of it. And I was just really scared, so I needed time to think. I took about 2 weeks to think, and my new PCP sent me to a pathologist who did the biopsy, and it came back as a papillary thyroid carcinoma, and then I knew it was cancer for sure, so I needed to do the surgery. There was no question. And so I had my complete thyroidectomy, partial parathyroidectomy, May 31st, 22, and it was successful, I think. I don't really know, because during the surgery there were some complications, and after the surgery the surgeon told me he noticed that I have nerve injuries. It's not something he could deal with, and that I would need to follow up with a nerve surgeon. I didn't really make anything of that because I'm like, what does that even mean? But boy, did I find out. After the surgery, I lost my voice. Like, I couldn't speak. It was not like it is now. It was actually kind of funny. I sounded like a frog. It was really funny. If I would try to sing or talk in a specific way, like, I had a really squeaky voice. Like, I had laryngeal nerve damage. It was sad, but it was funny. It was sad because I really like to sing. It was funny because it sounded really funny. But anyway, so yeah. It was after my surgery that I wasn't getting better. I also wasn't placed on the right hormone replacement therapy. I was placed on Synthroid, but not the proper dose, and not on T3, which is what I needed. So we only found out a year later that I needed the T3 hormone addition, and I also needed to take calcium for a whole year. That was kind of an interesting thing for me because it was scary. I had to take a very large dose of calcium supplements every day, because if I wouldn't, I would have a seizure. I haven't had a seizure, but because they took out my parathyroid, I needed to take calcium. So yeah. And after adding the T3 a year later, my calcium levels stabilized and I no longer needed to take it, which was really great because it was so annoying to take 9 tablets of calcium every day. But yeah, things get kind of downhill now. This is, if you thought up until now it got downhill, this was nothing. So summer 2022, after my surgery, after my thyroidectomy, I lost complete function of my right side of my body. Like, it was literally like I had a stroke. It just kept getting worse and worse. And yeah, it was really bad. I was no longer able to live in New York with my family there. I had to go to Colorado where my sisters live, and they had to take care of me. Like, literally feed me and bathe me and do everything for me because I couldn't do anything for myself. I had right-sided hemiparesis and I was in so much pain I couldn't do anything. I ended up with multiple blood clots in my legs and in my arm, and I needed to be on blood thinners. Now I'm on blood thinners for the rest of my life. I have to be on Xarelto. And my sister had taken me to a surgeon in Colorado, and I actually asked to see this surgeon because he was the only one that I've researched who could do the surgery that I wanted. I felt, to me, like I had no idea this was a vaccine injury. I had no idea this was anything, like I didn't know what it was. All I knew was that I had this droopy muscle, droopy scapula, putting pressure on my back, putting pressure on my leg, not being able to walk, having numbness and tingling everywhere, feeling like I'm on fire. And I searched this procedure where they kind of take your muscles and tendons and bring up the scapula and kind of sew it in place. And this is the doctor who was gonna do it, and I asked to see him. So my sister took me to see him, and I told him, this is what I'm feeling. He evaluated me. He was an orthopedic surgeon. And this procedure is called the Eden Lang procedure. It's not really done very often, but this guy does it, and I wanted him to do it for me. So, yeah. And he evaluated me, and in the first evaluation, he knew what was wrong with me. He ordered a scan called an MR neurography scan and of my neck, of my brachial plexus, and he had said that he suspects I have Parsonage-Turner syndrome, which is an inflammatory response caused by the immune system and caused by the immune system that attacks your brachial plexus and the nerves that control the arm and your upper trunk and chest nerves and muscles, basically. Probably didn't describe that correctly, but feel free to look it up. And so the scan showed exactly what he had suspected, and a month later, November 3rd, 2022, I had another surgery to decompress my brachial plexus, to remove the scar tissue and lesions there. And after surgery, I woke up. Some of the pain was gone, some of the numbness was gone, but within 3 months, it came back. Everything came back. It was like nothing had happened. Some of the fire burning sensations went away, but it was still there in a different way. I can't really explain it, but it was still there. So we are now in 2023. I figured I got my function back. I can go back to New York. I can go back to my job. I can go back to my life. And I can try and get my life back together. I didn't know that I would need more surgery and I would be in pain. I wasn't wearing this brace at that point. The doctor who put me in it told me to wear it and not take it off until I had surgery, and I'm like, I've had 2 surgeries in my neck, I probably don't need it anymore, and I took it off, which I shouldn't have done because I made things worse. And so yeah, I went back to New York in 2023. I went back to work. My job rehired me, and I was still in a lot of pain. Like, I was still having numbness in my chest and in my arm and pain in my leg. I couldn't walk. I was barely walking. Like, I was walking with one leg and the other leg was outward, like I had a stroke, basically. But again, my brain scans were clean. So yeah, I was in a really bad situation. You could watch my other videos on this. I do have some other videos, but I was kind of feeling like ending my life because of the pain. Like, it was that bad. Like, I needed to be on painkillers and I didn't want to be on them, and it was a really bad situation. And my sister was telling me, you know, just wake up one more day, something good will happen. And I'm like, okay, you know what, let's just see what this does. And then this one day, I started to research my pain and not listen to what other doctors have told me, and just I found this doctor in Nevada who I wrote my situation, I wrote my case to him, and he agreed to see me. And it's like a whole other thing, but you can watch the videos on that. And he diagnosed me with piriformis syndrome. Basically sciatic nerve compression at the piriformis level, which we did an MRI of my spine to make sure it wasn't my spine causing any of the symptoms, and it wasn't at that point. And I flew to Nevada and I had a surgery to remove my piriformis muscle on the right side. which alleviated 100% of the pain that I came in with. And it was a total miracle because I never ever thought that I would ever have my leg back and be able to walk again without wanting to kill myself from the pain. And again, if you guys thought this was a crazy story, not even there yet, not even close. This was May 9th, 2023 that I had my surgery to remove my piriformis, and I was recovering well. I flew back the next day. Because my nerve surgeon in Nevada, because he was a specifically a peripheral nerve surgeon, I told him about, my upper extremity pain and what was going on, and as he suspected, I would require another surgery, and it took time for me to get that because I needed to raise funds for it, and so we did that. So, sorry about that. The light was getting really dark outside. I didn't have the light on. But yeah. So it was May 9th, 2023. I had my piriformis removed, and I flew back the next day. The surgery went great. I was able to walk again without pain and feeling like I'm gonna just end my life because of it. And I was able to get off the morphine completely for a few months. And then the upper extremity pain, because like I said, my nerve surgeon was specifically a peripheral nerve surgeon. I told him about my situation with my upper extremity pain, and like he suspected, I would need another surgery in my neck to decompress the brachial plexus and remove scarring and all the tissue that was just in the way of the nerves functioning properly. And it took time to get that surgery because I had to raise the funds for it. Again, I wasn't making a lot with my job, and I tried to find a doctor in New York to do the surgery because I wanted insurance to cover it so that I didn't have to go and wait so long to be able to get this life-saving surgery that I needed. It was getting hard to breathe. Like, I couldn't breathe. My phrenic nerve was being compressed and it was so hard to breathe. At that point, I already put on a neck brace. I had a different one than this, but those are no longer being made, so now this is what I have. I wear the brace because I can't hold my head up from the muscle weakness and nerve injuries that I have. Without it, I will start passing out, and again, like, I will get dizzy, can't see anything, get nauseous, but the bigger problem is start passing out. And so yeah, and when I was looking for a doctor to do my surgery in New York, it was a surgery that they would do, like scalenectomies are done for thoracic outlet syndrome. I had a neurogenic thoracic outlet syndrome with brachial plexus compression, basically, and I found this vascular surgeon and like a few surgeons who for some reason like acknowledged that I have the symptoms but didn't want to do the surgery for me. They just told me to do injections into the neck and to just live my life in pain. And then I had brought my I done a diagnostic injection at HSS in New York, where I lived at that time, and it went great. Like, I had no pain, so I was a candidate for the surgery, and I was able to breathe, which felt amazing. And I took the results to the vascular surgeon. I said, look, the scalene block worked, which means I'm a candidate for surgery and insurance can pay for it. And this was the surgeon that said to me, insurance will not cover it because you will not survive the surgery, and if you do, you will have complications. I'm not quite sure why he said that. At that point, my doctors were already telling me that I should be on palliative care because I couldn't breathe and the pain was so bad. I couldn't do anything at all. And when they were telling me to be on palliative care, it was because of the pain and the anxiety that I was having because of the pain, that they wouldn't treat outpatient and it had to be under palliative care. So basically they were saying that I'm dying and that's what I should do. just go. And I wasn't ready to give up at that point, even though I'd started the process. Like, I had already spoken to the therapist, part of the palliative care program. I had spoken to the spiritual guider, part of the palliative care program, and the last step was getting the pain pump for it. And it just happened to be that someone in the community heard my situation and offered to pay for surgery, and gotten other people involved, and we were able to raise the funds for the surgery. And I flew to Nevada, where I had my surgery. My surgery happened January 31st, 2024, which was like a really long time from when I was having all these problems. I mean, we already knew that I would need their surgery like 6 months earlier, but I couldn't get it in New York. No one wanted to do it. And the surgery that they said I wouldn't survive, here I am. Thank God I survived it, and it was just like without complications, without anything, just like they said that would never happen. And we are now in June, almost July, so it's about 5 months now since my surgery. And I would say I'm like 99% there, where it was completely successful. Every symptom that I had that I went into the surgery with, I came out without of, which is just crazy, amazing, and whoa, yeah. So at that point already, after my surgery, when I woke up, I was still having pain, but not where my surgery was supposed to be targeting. It was on the other parts of my body, where I kind of call them hotspots, like specific areas where I'm having serious pain and numbness and burning. Whereas before it was just the entire right side, now it's just specific spots that radiate. And it's almost hard to tell the difference because it continues to get worse. So I knew that for the remainder of my treatment, I would have to move to Nevada because I wasn't getting it in New York, and there was no sense in staying there. There was no doctor willing to treat me. So I made the move to Nevada in March, and I had my follow-up appointment in April. I think it was my 6-week follow-up or something like that. And I had told my surgeon that at the follow-up that I'm still having pain in specific areas in my arm, and parts of my head was hurting, and my leg, my lower leg, and parts of my chest and abdomen was hurting, and pelvis. And it's like the same kind of nerve pain. Like, now I know it's nerve pain. And we were trying to figure out what caused it, and we had already known that like I had the Parsonage-Turner syndrome, which was caused by the vaccine, but we didn't know that it was to this extent, where Parsonage-Turner only affects your upper extremity, and I'm having symptoms on the entire right side from the neck down, which isn't going away. So that's when I found out the news that I have a vaccine injury caused by the COVID vaccine. Specifically, the one that I got was Pfizer. And like I said, if you guys thought what I said before was crazy, this isn't anything crazy until now. Yeah, so I have a really long battle ahead of me because I'm gonna need treatments that insurance won't cover. They haven't covered till now, and I've just been living off of the charity that I've been getting from people. And yeah, so moving to Nevada was the plan, to get medical treatment, but the plan was to try and work. The plan was not to become disabled. The plan was to get my life back, and unfortunately it's not as what I'd hoped it would be, because now I can't work, and I can't work because of the pain. The pain is so bad. It takes all my energy just to not kill myself from it. It takes everything out of me just to wake up and get through the day because of the pain. So that's a full-time job on its own, just dealing with the pain. And it's become so bad where my doctors have told me that I should start using a wheelchair because the right side of my body has hemiparesis. And for those of you who don't know what that is, that's partial paralysis or weakness, motor weakness. So I can still use my arm and my leg, but my trunk muscles are the ones that's most affected. And the pressure from that and the pain from that really doesn't allow me to use my arm and my leg as much as I want to, or be able to use it functionally, meaning. So it's not possible to do daily activities or basic needs on my own like I used to be able to do. I was able to get some braces to help with the pain and to help me be able to at least stay semi-mobile so that I could at least try and do something for myself. But eventually, at the end of the day, I'm gonna need to use a wheelchair, which I'm still waiting for insurance to approve because that takes like 90 days from what I've been told. Yeah, the purpose of the wheelchair would be to take the stress off my body. And I think my doctors know what they're saying, because had someone told me this sooner, I probably would have not developed bulging discs in my spine and spinal problems, because I continue to use the parts of my body that I shouldn't be using, because if I can't do it and I'm forcing myself to do it, I'm just causing myself more damage. So as hard as it is for me to accept, this is what I need to do. And it's very sad for me to say that I've actually been bullied for it because of the way that I look. Because I'm 27 and I look young and I look healthy, but I'm all braced up and I need to be using a wheelchair and I get bullied for it. For those of you who are wondering why my face is so puffy, it's because I'm on a really high dose of steroids, and that happens when you're on steroids. I need to be on steroids because of the pain, that the inflammation causes pain. And it's very hard for me to get off of them because being in my situation, having no place to go, being homeless, being dependent on people. So when I moved to Nevada, the plan was for me to be able to work and have an apartment. The plan was not to be sitting in a wheelchair and going from house to house and having people take care of me and strangers take me in and ending up in different places every other night or so. So I have to keep myself as functional as I can so that I don't depend and rely on people and get taken advantage of, because when you're in a wheelchair, when you can't do things for yourself, that's what happens. So being on the high dose steroids, this is what is able to help me get out of bed and to do something for myself so that I don't sit in one place and get hurt or something like that. But yeah, so now this is where the story stops, because I have yet to decide what is going to happen, and a lot of it isn't in my control because I don't have the source of funding for the treatments that I need. And I've tried to get an attorney to help me with this, but no one will touch my case because the vaccines are protected by the PrEP Act, and basically they're untouchable. Everyone is untouchable. Yet somehow, like, I still ended up dependent on their system, so it really makes no sense. Yeah.